Come in.
Hello, how you doing, man?
I'm good.
Good. My name is Thor. I'm one of the Hersey students. I'm here today to do a head-to-toe assessment to you. Before I start, I'm just gonna wash my hands and put on some gloves.
Okay.
Wash my hands and put on some gloves. Perfect. And before we start, can I have you verify your last name and date of birth, please?
It's my Maiku 9/12/1989.
Perfect. So this assessment is going to be I'm just going to be assessing your skin and be some touching. So if you feel uncomfortable, just let me know.
Okay.
All right. So general appearance: patients alert and oriented, dress appropriate to weather. Hygiene is great. No odor. So perfect. So I'm gonna start off with the head. I'm gonna assess the head. I'm gonna check out the scalp. There's no lesions, no bruising, no bumps. Any pain at all?
No.
Perfect. And then once the head is done, head is normal cephalic, so which is good. So after the head, I'm gonna assess the face. Just looking at the face, there's no drooping. Eyes are symmetrical. Any pain?
No.
Perfect. Okay, so I'm just gonna get one of this, and we're gonna be checking for cranial nerve 5. So I'm gonna have you close your eyes for me, please. So I'm gonna put this along your face. Let me know if it's soft or if it's sharp.
It's soft.
Soft.
Soft. Sharp. Sharp.
Perfect. So cranial nerve 5 is working, and then once that is done, we're gonna be doing cranial nerve 7, which is the facial nerve. So I'm gonna have you smile, frown. Perfect. So the facial nerves are working. Facial muscles are working. And then once that is done, we're gonna go to the eyes. Upon inspection, there's no swelling. The eye is no swelling. The sclera is white. Conjunctiva is pink and moist. There's no draining. There's no any pain at all.
No.
No. Perfect. All right, and then once I assess the eye, I'm gonna be doing Perla. I'm gonna assess for the pupils. See if it's round and reactive to light. So check. Okay. Alright, it's constricted on both sides. Perfect. So both pupils are equally rounded and reactive to light. And after this, we're gonna do the accommodation test. So I'm gonna have you look at the pen right here, and then just follow it. Perfect. So eyes are constricting perfect. So accommodation is there. Very good. Once that is done, we're going to be doing the 6 cardinal gauges. So just follow my pen. Go up here. So here I see is we're checking for cranial nerve 3, and to the side. So her right eye is nerve 6, and the left side is nerve 3. And so we'll go down here. Her right eye is checking nerve 3, and the left eye is nerve 4. And on this side, so her left eye, we're checking nerve 3. Both eyes nerve 3. We're going to the side here. Left eye is nerve 6, right eye is nerve 3. And then we're going down here. Left eye is nerve 3, and right eye is nerve 4. So all cardinal gauges are perfect. And very good. And then after this, we're going to check for cranial nerve 2, which is the ocular nerve. Here we're going to do the Snellen chart. I don't have one, but 20/20 vision is perfect vision. But if a patient has 20/40 vision, what that means is a person with 20/20 vision can see perfectly at 40 feet as to where a 20/40 vision person sees at 20 feet. So here we are done with the eyes. I'm gonna go with the ears. First, I'm just gonna assess the ears. Make sure there's no drainage coming from the ears. No lesions. I'm gonna feel it. Any pain or tenderness?
No.
No. Perfect. Ears are symmetrical and midline to the head. Once the assess is done, I'm gonna get a otoscope. I'm gonna check inside the ears. Here's my otoscope. Here and here, I will see the tympanic membrane should be clear and pearly gray, no transparent pearly gray on both sides, and you will see the cone of light. So for the cone of light for the left, for her left ear here, you will see at the 5 o'clock, and for the right ear, you will see at the 7 o'clock. And then once that's done, we're going to be doing the whisper test, or we're checking for we're checking for our cranial nerve 8. You say. So I'm going to say 3 numbers, and she's going to repeat it back to me. So,
1, 2, 3.
and then this side.
1, 2, 3.
Perfect. So cranial nerve 8 is working. She's hearing fine. Once that is done, I'm going to be doing a Weber's test. So with the Weber's test, I need a tuning fork, but I have my trusty fork here. For this to work, I'm going to hit on my hand. It's going to be shaking. It's going to be vibrating. I'm going to put it on top of her head, and I'm going to tell her, I'm going to ask her when she stops hearing or feeling the vibration. So you feel the vibration?
Yes.
Is it done? Yeah.
It's done.
Okay, perfect. And then after that, we're gonna do the Renee's test. And with that, again, I'm gonna bang it on my hand. So I'm gonna put the tuning fork on the bone back here. I forgot what it's called, but I'm sorry. Here, with the Renee's test, she should start feeling the vibration with the bone, and then when I put it to the ear, she should be able to hear the ringing from the vibration. And what that means is air conduction is greater than bone conduction. So the ears are done. After that, we're gonna be going to the nose. With the nose, I'm gonna just assess the general appearance. Make sure there's like no redness, no bloody nose, no drainage. And after that, I'm just gonna assess inside the ears. I'll make sure it's clear. There's no lesions in there. Perfect. After that, I'm just gonna check for the patency of the ear. So just cover one nose and blow in and out, and then do it again on the opposite side and blow in and out. Perfect. And both ears are painted. After that, we're gonna check for cranial nerve 1, which is the olfactory nerve. So here again, I'm gonna have you close your eyes, and I'm gonna have you smell this and tell me what do you smell. What do you smell?
Coffee.
Perfect. So our smelling senses are working, so which is good. Once that is done, I'm gonna go to the neck. With the neck, I'm just gonna assess the throat, make sure it's midline. I'm just gonna say, is there any pain, any tenderness?
No.
No, perfect. And then after this, I'm gonna check for any JVD. There's no jugular distended veins. And at this portion, I would also like to check the thyroid, where I would go behind her. And I'm gonna move her. I move her trach to the side, just feel for any masses or any enlarged lymph nodes, and there's none. So which is good. And then once that is done, I'm gonna check for the lymph nodes. So So I'm gonna go for the pre-auricular, post-auricular, occipital. And this is the superficial, tonsillar, submental, submandibular, the deep cervical chain. And then this is the superficial clavicle. No, this is the posterior clavicle, and then the superficial clavicle down here. And there's no enlarged lymph node, so which is good. Once that is done, we're gonna go inspect the mouth. So I want to assess. So upon inspection, just check the lip, make sure it's not. Oh, beautiful smile you have. But make sure there's the lips aren't blue. There's no crust, anything. It looks good. So I'm gonna have you open your mouth. So open wide, and the mucous membrane. The mucus is pink, moist. No bleeding. There's no lesions. And at this point, we're gonna check. I'm gonna have her. Well, we're gonna check for her gag reflex and cranial nerve 9 and 10. So I'm gonna have her open her mouth. So I'll pull it back here, open your mouth, and say ah, and then go ahead and swallow. Perfect. So 9 and 10 is working perfectly. And then next step is we're gonna check for cranial nerve 12. So I'm gonna have you stick out your tongue. Stick out your tongue and then move it left and right. And she's able to do it. So cranial nerve 12 is working, or it's good. Once that's done, the head is done. I'm gonna move down to the lungs and thorax area. So here, I'm gonna inspect the skin, make sure there's inspect the skin integrity, make sure there's no skin tears, no bruising, and after that, I'm gonna palpate for any lumps, any masses, any tenderness. So no pain,
No.
no tenderness.
No.
Perfect. And once that's done, I'm gonna auscultate front and back 9 times both sides for a total of 18. So for the back, I'm gonna assess for bronchophony. So there, what I want to have you do is I'm gonna ask the patient to say 99, and what I should hear are muffled sound, not clear. If it's clear, there are area consolidation. For the egophony, I'm gonna have the patient say e e e. I should hear e e e and not ah ah ah. If I hear ah ah ah, that means there's some area consolidation. For the front side, I'm gonna do the same thing, 9 on each side. I should do it. So 9 on each. So 9 on each side. And here I will be listening for the bronchial sounds, bronchial, vesicular, and vesicular. For the bronchial, which is this area right here, you should hear a high-pitched, loud sound. For the bronchial vesicular, which is this area, you will hear like a medium pitch sound. And for the vesicular area, which is down here, you hear like soft and low pitch. And then once that's done, I'm going to be doing a tactile firmitus. I'm going to use the palm of my hand. I'm going to put it on her back. And where I'm going to have her take a deep breath. Both of my hands should move out when she breathe in, and come back to normal position when she breathes out. And once that is done, I'm going to inspect and auscultate the heart. So for the chest area, I'm gonna inspect, make sure there's no bruises, no ports, make sure the skin is a normal color. The color is normal. I'm gonna palpate it, make sure there's no pain, no tenderness, and once there's no pain or tenderness, I will auscultate for the heart sounds. For the aortic, it's gonna be on the second intercostal right sternum border. For the pulmonic, I'm gonna move it to the other side, second intercostal left sternum border, and the Erb's point move down one intercostal, which is the third intercostal left sternum border. And for that tricuspid, it's going to be between the fourth and fifth intercostal left sternum border, and the mitral valve, which is the fifth intercostal mid-clavicular left sternum border. Once that is done, I'm gonna go ahead and check the pulses from here. Hey, don't jump too. So I'm gonna check the pulses. For one, I'm gonna assess the skin on her arms. Check for the cap refills. It should come back right away, less than 3 seconds is normal. And then I'm gonna check all the pulses, the temporal pulses, the carotid pulses. So we'll just do it one each side, so separately for the carotid. And then for the rest, I would do it bilaterally. So for the brachial pulse, and then the radial pulse. And for me to find out the pulse, I'm going to read it for 30 seconds. And then I will multiply that by 2 if it's regular. If it's irregular, I would count for a whole minute. And then once that's done, I'll do the femoral, which I'm not going to go. And then we're going to go to the popliteal, which is the back of the knee. And then once that's done, we're going to do the pedal pulse, which is the front of the toes. And then the posterior tibialis, so this side. So we do these bilaterally. Perfect. And once that's done, I'm going to go ahead and do the abdomen. So for this portion, I'm going to have the patient lie down on her back. So lie down on her back. So feel it, perfect position. Lie down on your back, on your back. There. Just fix your head. Perfect. So let me fix this for a second. All right. So for the abdomen, first I'm gonna inspect the skin. Well, inspect the abdomen, make sure it's not distended. There's no abnormal findings. Once that is done, I'm gonna auscultate. So when I auscultate, I'm gonna start from the right lower quadrant and going clockwise. Once you do that, you're gonna listen for about 5 minutes on each quadrant. Then once the auscultation is done, we're gonna palpate. So we're gonna do 2 different type of palpating. So the first one's gonna be light palpating, and for the light palpate, I'm just gonna palpate, make sure, ask if there's any pain, any tenderness on each side.
No.
And then once you do the light palpation is about 1 or 2 inches. And then we do deep palpation about 3 to 4 inches. We're gonna go a little bit deeper. If the patient says they have like a pain, and while you do the palpate, you're gonna be looking at the patient's face, make sure the patient's not grimacing or showing any sign of pain. If you do, you would focus more on that side towards the end of your assessment. Well, towards the end of the abdomen assessment, and just focus on that side if there's any pain. And then once that's done, I'm gonna percuss. Tato, it's okay. Come on, you put your. Sorry about that. So with the percussion, so I want to percuss, all four quadrants, and you would expect to hear timpani. Timpani is normal. If you hear any dullness, or if you're in a dullness, that means that there could be enlarged organ or a mass or something on that side, and that's an abnormal finding. So that is all done for the abdomen. Once that is done, I'm going to have the patient sit up for me. Oh, well, not yet. Yeah, she can sit up. So I'm going to have the patient sit up for me. We're going to be doing musculoskeletal. I'm going to have her do a range of motion on her neck, left and right, up and down. So everything's good there. I'm going to have her do the shoulder. Can you stand up for me, please? So we're going to be, I'm going to have her put her arm out. Okay, put her arm out. So this is prone, and then turn. That is supine position. Prone, maybe.
Yeah.
And then I'm gonna have her put her arm in. So this is the flex, extend. I'm gonna have her grip my fingers. Perfect. Grip is equal bilaterally, and then just let go. And then so put your arms out again. I'm gonna do a resistance. So go ahead and flex and do the resistance. Go flex, go pull in, and then push out. Push out. Perfect. So strength and resistance is there, so which is very good. And after this, we're gonna do a internal and external rotation of the shoulders. So I'm gonna have you put your arms out. So this is behind you, internal rotation, and then go external rotation, and that is normal. Very good. So once that is done, I'm going to check the last cranial nerve, which is 11. So I'm going to have her shrug with the resistance, and there is resistance. So very good. She's able to shrug. So once that's done, you go ahead and sit down. And once that's done, we're going to be doing the wrists. Well, we could do the elbow since I did, but we could do the elbow again. So we're just going to, for the elbow, we're going to do internal. We're going to do flexion and extension. So flex, extend. So the same side on that side, flex and extend. Perfect. And so for the wrist, we're going to have you rotate your wrist. For mobility, perfect. We're going to do inversion. Put your hand up. Inversion and eversion. Perfect. And then once that's done, we're gonna do the hip. Now we're gonna go to the hip. So I'm gonna have her lay back down. So for the hip, we're gonna do the internal and external rotation. So what I'm gonna do is before that I'm gonna have her bend her knees, and then we're gonna do abduction. So abduction is going out, and induction. Abduction going in. So and then legs out again. So hip rotation, and we'll do the same time on the right side. So we're gonna bend your knee, and then we're gonna do adduction. So going out, and you go back up, go back in, abduction. And we're gonna have her extend her knees. Perfect. Here, I'm also gonna be testing the strength of her legs. So you pick up both of your legs. Perfect. Perfect. And I'm going to have her push against my hand for strength and resist. Perfect. After that, I'm going to have her do her feet, which is the inversion and eversion. So an inversion and an eversion. Perfect. And after that, I believe I am done with my assessment. So I'm gonna have the patient sit up for me. Oh, then we're gonna do that's right. We're gonna do the balance test, but I forgot. So I'm gonna have her stand up. So here, patient is able to balance herself. Normally I would have her walk back and forth just to check the gait, but I don't really have a room here. So, and turn around. So gait is normal, and have her bend down and touch her toes if she can. And she did great. And have her sit back down. Oh, another thing I missed, but I'm gonna have. So I'm gonna do the sterogenesis and the sterogenesis and well, we're gonna have her do the sterogenesis. I'm gonna have you close your eyes, put your arm, hand out. I'm gonna give you an object and tell me what do you feel.
Battery?
Perfect. And I forgot what this one's called, but I'm gonna draw something on your hand. Tell me what shape you see.
A Philly circle.
Perfect. And after that, my assessment should be done. Here, I want to ask the patient if he needs anything. Make sure the patient is comfortable. I'll put a call light next to the patient and let her know if she needs anything. Just give me a call, and I'll go wash my hands and be done with my assessment, and I'll go out.